Hi, I'm Dr. Adatol Musa.
Hi, I'm Dr. Hussein Musa.
This is Healing Talks with Kingdom Docs.
Thank you so much for joining us. Last time we talked about our healthcare system and how there are barriers in place that can prevent patients from getting access to healthcare. And the model that we are using is a direct care model where we work directly with the patient. Now, in a direct care model, there's often a monthly subscription, and there's a concern for patients as why should I pay for a monthly subscription when I already have health insurance that I'm paying for? Now, this monthly subscription for a direct care practice for us, it means that you will have access to specialty care. Now, regardless of your health insurance, it may take you a couple months to see your specialist. You may only be able to see them a couple times per year. You may only have a few minutes to visit with your specialist, oftentimes 10 to 15 minutes, versus a direct care practice. You have access to your doctor. You can have an hour-long appointment. You'll have a doctor who calls you back. You'll have a doctor who knows you.
Yes, who knows you.
So how much is that worth? That constant addressing of your illness can lead to healing instead of disease management. And how much is your health worth? How much is it worth to be kept out of the hospital, to be kept out of the emergency room, or to have the peace of mind knowing that if something happens, you could call your doctor and see them that day or the next day, or that they'll call you back? How much is that worth?
Yes, it's priceless, really. And then on the flip side, there are some other patient populations that would benefit from direct care, especially business owners, small business owners that may or may not have insurance, or their insurance is a very high deductible. And so they do end up paying a lot of things out of pocket. And then there are other options as well as getting reimbursed for the visit, maybe up to 60% out of network if a patient does have insurance. So many options to get excellent care.
Yes. And at our practice, the Kingdom Healing Institute, we are providing direct care access for pain medicine, addiction medicine, neurology,
and epilepsy.
Yes. And one thing that we love is our focus on healing.
Yes.
We're very passionate about God and the healing power of the Word of God, the healing power of Jesus. And that's one thing that's unique to our practice, that we include prayer for our patients.
Absolutely. Prayer works, and we have personal testimonies on the healing, miraculous prayer in our lives, and the healing power of Jesus Christ. And I've seen it in my patients as well. So it's something that we incorporate.
Yes, and I recall I love praying for my patients, and what was really interesting, every time I prayed for my patient, almost without fail, if they were a new patient, you know what they would tell me?
What?
You're the first doctor who ever prayed for me.
You know what? I get that a lot too. And I also get a lot of enthusiasm. Like, I can't believe you want to pray for me. Let's do it. Let's do it now.
Yes, and we know that we're more than just flesh and blood.
Yeah.
And I believe having a doctor who has the time to know you, the time to learn your history, and the time to pray for you, I think you're just going to do better.
It's pivotal that we understand that this is more than just flesh and blood. And with this direct care model, we have the time to really treat the patient on a physical level, their body, on a spiritual level, and also to treat their soul.
Yes, yes. We know that the King heals, that Jesus heals, and we're all instruments. And I'm just blessed that we have the gift of healing, that we can work with patients, we can use our knowledge, but also use our gifting to promote your health. And we have the time to spend with you to help you.
Absolutely. So we're going to go more into this in the next episode of Healing Talks with Kingdom Docs.
Thank you so much, and God bless.